actually this year was very active in the prostate cancer arena at this ASCO. You know, we had one presentation at the primary stage, and there was the VISION trial with the PSMA lutetium therapy. We had a number of other important trials that read out, and we learn more about what's going on. Just to start with VISION trial, which I predict is going to be a changing practice trial, in the sense that it basically is a large phase 3 trial that basically investigated the addition of lutetium PSMA therapy to standard of care in men with metastatic prostate cancer that have progressed on at least one line of taxane-based therapy and at least one line of novel hormonal therapy. The primary endpoint of this trial was overall survival, and the trial did meet the primary endpoint, and with a delta of around 4 months, favoring the combination of lutetium-177 PSMA with standard of care. The standard of care was limited in the sense that it did not include chemotherapy, did not include radium-223, and so basically allowed novel hormonal therapies. It did allow steroids, palliative radiation. Still, it's important because it's the first PSMA-based therapy to reveal a survival advantage in individuals with metastatic castration-resistant prostate cancer. So personally, I think that is super important because it kind of is going to open the door to a number of PSMA trials that are being, ongoing right now, and will likely, prove to be beneficial for our patients. So it's truly important data, and kudos to the authors, including Dr. Mike Morris, Dr. Oliver Sarter, and others for those efforts. I would like to highlight a few other important studies that were presented at this meeting. One of them is called PEACE1. PEACE1 is a large phase 3 trial led by Dr. Fizazi, that basically, enroll patients with de novo metastatic castration sensitive prostate cancer to standard of care, or standard of care plus abiraterone, prednisone, plus minus radiation therapy. The primary endpoint of this trial including radiographic progression-free survival and overall survival. At this time, the overall survival data is immature, and so we basically saw data regarding radiographic progression-free survival. The benefit of around 2 years, is clinically meaningful, favoring the combination of standard of care with abiraterone plus minus radiation therapy. There's a number of questions that that we have regarding the trial because we don't have all the data, including survival data. One of those questions would be, regarding the role of triplet therapy versus a doublet. Keeping in mind that a good proportion of patients on this trial did receive ADT plus docetaxel as the standard of care. And so that's not ready for prime time yet, whether or not the triplet regimen is going to be available for all patients. We do have, just to give a context, we do have trial in the past. There was Enzalutamide that showed us that there was no role for the combination of ADT with docetaxel and enzalutamide in that particular trial. So it'll be very interesting to see, with more follow-up data, it'll be very interesting to see what happens in regards to this question about doublet versus triplet. I think his potential, he has potential to change practice. It's a very important trial that we're all looking forward to seeing the data, and we're looking forward to get more, follow-up data on this particular study. It's a very important study, so kudos to Dr. Fizazi and the group. The other study that I would like to highlight is actually the same name, but PEACE3. And this is an important study because it tested a combination of enzalutamide with radium-223. And what is important about these studies, because the context came from, the former study with Abiraterone, a similar design, combining Abiraterone with radium-223 called ERA-223, that showed us that it was not safe to combine both. What this trial, in basically the data we saw today, was not the final results on PEACE3, but rather the safety data looking into the fractures data regarding enzalutamide alone and enzalutamide plus radium-223 with or without bone modifying agents. And as the authors highlight nicely, the take-home message from this trial, in my opinion, at this time is it seems that right now, in regards to fractures, the data does strongly emphasize the importance of bone modifying agents in combination with not only radium enza, but also enza alone, as you see a significant reduction in terms of the instance of fractures for patients who were treated or were offered bone modifying agents. And to me, that's the take-home message, the main take-home message from this particular study at this point. Again, this was an analysis done by, mandated by the Data Safety Committee to make sure there were no safety signals that would make us, get some pause on this trial. The trial will continue and will read out to the endpoints design. But I would like to highlight, PEACE3 for that particular reason. I would also like to highlight the SWOG study, the S1216 by Dr. Agarwal in the group, because it was a negative study, but we have a lot to learn, not only with positive trials, but also with negative trials, right? So, so this particular phase 3 trial that basically combine ADT with a novel CYP17 inhibitor, known as TAC700 or Turinal, that is not exactly the same as Abiraterone, and is a potentially greater 1720 lyase select inhibition. And so basically, it's an intergroup study. It's a large study where they had overall survival as the primary endpoint, and then secondary endpoints of interest, including radiographic progression survival, PFS, PSA response, etc. This study overall was negative, and so TAC17 will not be likely approved in the first line setting for patients with metastatic hormone-sensitive prostate cancer. But to me, what is very interesting in the results of this trial, as Dr. Agarwal did point out elegantly in his presentation, was the longest to date reported median overall survival of the patient population in the control arm, meaning ADT plus bicalutamide, which was really the control arm. And it was around 17 months, which was unprecedented in all contemporary trials conducted in the hormone-sensitive space. It was by far the highest, the longest overall survival observed in the control arm. And that's probably a strong reason why we did not see a difference with the addition of TAC17 to the standard of care. And so I think it's important because it kind of suggests that, as Dr. Agarwal also showed, that more patients are getting access to novel life-prolonging therapies at time of progression when developed castration-resistant disease, and they would very likely help to explain the results observed in this particular trial. And all these studies that I mentioned were basically, we did have oral presentations on. In addition to that, I could highlight significant other very important trials and studies presented at this year's ASCO in the prostate cancer arena. I would probably highlight one of two studies done with other PSMA therapies at an early stage of developing, really showing promising results. I'm thinking of the trial by Dr. Tagawa. I'm thinking about the trial, by other authors. And really, I think what's coming, where we're going to be seeing the near future, is a wave of PSMA therapies showing us, how offering that therapy to patients is able to improve clinical outcomes. So I would say stay tuned to the PSMA therapies for patients with advanced prostate cancer. And so, there's a number of other trials that are worth noting, but I would say, we had important data in the hormone-sensitive space. We had important data in the castration-resistant setting. We have novel emerging therapies with interesting, promising data at this time. We had a more dive into the genetics, the importance of different biology of patients. We had, important data regarding racial disparities. And so I think it's a very comprehensive overview of the prostate cancer studies at these ASCO